Known case of COPD with recent onset of acute diarrhea. ABGs show pH 7.12 and PO 270, CO 250 and HCO 37. Diagnosis is? During repair of right inguinal hernia, which structure is most likely seen? A patient presented with a valvular defect. He got his valve replaced. After 1 month he developed tricuspid murmur, red sclera and gingival spots. Diagnosis of infective endocarditis is made. The involved bacteria is? Most characteristic feature about actinomycosis is aortic valve is closed at the onset of a 20-year-old man with rheumatic valvular heart disease has been running a low-grade fever for the last of 2 weeks. In addition to a pansystolic murmur, he is found to have splenomegaly and clubbing. The treatment should commence with calculate the mean arterial pressure of a patient whose diastolic arterial pressure was 66 mm of mercury, systolic arterial pressure 132 mm of mercury and central venous pressure 1 mm of mercury. His main arterial pressure will be the most sensitive test for DIC is an ICU patient with CVP line in subclavian vein for the past 10 days is on parenteral nutrition. He develops fever, and gram staining reveal clusters of gram-negative cocci. The drug of choice in this patient is upper two-third of esophagus carcinoma? During suprapubic catheterization, a transverse incision is given. Which of the following is most likely to be damaged? A male presented with generalized skin nodules, marks of scratches on face, loss of hair and eyebrows, nasal bridge shortening, and gives history of contact. Acid-fast bacilli positive. The biopsy of skin nodule shows the causative agent? A person going to 4th floor starts climbing the stairs rapidly. Upon reaching, his cardiac output has increased by 50%. This increase in cardiac output is due to which of the following technique detects microdeletions by using probe? A patient presented with 3-month history of fever, bilateral lymphadenopathy and hepatosplenomegaly, anemia and fatigue. He gives history of sleeping on the floor and bite by some fly. On peripheral blood film, unicellular structure can be seen. The diagnosis is inability to produce a urine pH less than 5.4 even when challenged with ammonium is found in diffusion of gas is directly proportional to A 30-year-old male is on total parenteral nutrition for the last 1 month, develops scaling dermatitis and alopecia. The condition is most likely to be due to deficiency of A 30-year-old man had a road traffic accident and sustained a fracture of femur. 2 days later, he developed sudden breathlessness. The most probable cause is pendular knee jerk occurs in